and welcome to yet another episode of Body Garage here on TV 47 with I, Sheila Chelangat. And on this episode, we focus on oral health. While you know that oral diseases are largely preventable, sometimes it can be a burden to majority of people in many countries, with the WHO estimating that about 3.5 billion people actually do have oral diseases. And so true to our show, we will leave no stone unturned, and today we have a live audience in studio, Mount Kenya University Dental Student Association and their patron. Habari zenyu? You're happy to be here? Yes. Glad to have you guys. And we will start with closest to my right. Introduce yourself and what year of study are you?
Thank you, Sheila. I'm Gashoki Charles. I'm a fourth-year student, and above that, I'm a member of the Mount Kenya Dental Student Association. I've held the role of a special advisor in our recent published magazine, and we'll talk more about that in this show. Thank you.
All right. To the lady.
Thank
Hi.
you so much, Sheila. My name is Esther Odwar Adera, and I'm a fourth-year student at Mount Kenya University. And in our recent publication, I am the overall project coordinator of the magazine.
Great to have you in studio. Let's have the gentleman next to you.
Hello, Sheila. Thank you so much. My name is Masfin Juma. I'm also a fourth-year student, and in this recent magazine project, I was the editor-in-chief of the magazine. Yeah.
All right. As the editor-in-chief of the magazine, perhaps you could just fill us in. What was this magazine about, and what was the project about in general?
Yeah, so in our magazine publications, we normally address different areas, but in line with our area of interest today, we normally give dental health a priority. So dental health was one of the key aspects that we really gave a lot of importance. And here we try to tackle the topics that we feel they are addressing the immediate need about conditions or either the current recent development in the field of dentistry that we feel it's relevant for people to be equipped with.
So I'm assuming that from that you guys are actually advocates of good oral health, right?
Yes.
All right. So Esther, perhaps could you tell me, why are you really passionate about oral health? Why is it a thing that you decided to participate in the project?
Well, oral health is one of the basic things that a person needs to look out for in life. And if your oral health is compromised, basically, or your general health is also compromised. So that is why, as a student and as an advocate of oral health, I've taken it to be my personal initiative to advocate for good oral health.
Okay, Charles, let's come to you. You all are advocates of good oral health, but someone at home is wondering, what really makes up good oral health?
Okay, thank you, Sheila. I think we can start by defining what oral health is. And oral health can be simply defined as the state of the teeth, the gums, the structures of the mouth and structures of the face, and how they enhance our ability to speak, chew, breathe, and also encompasses the social dimension, in which for good oral health means you can do your work without pain, without discomfort, without embarrassment. That is basically oral health.
And are there causes of bad oral health?
Yeah, for us to say someone has a compromised oral health, we have to look into many factors. Some pointing factors we can say is by looking at the person's mouth. For example, if we have any decay in the mouth, if we have bad breath, if we have bleeding gums, which is not normal when brushing, if we have painful gums, those are all indications of bad oral health. And there are some diseases which have been linked to the deterioration of oral health. Such diseases include dental caries, which means decay, gingivitis, the bleeding gums, which can progress to periodontitis, leading to loss of teeth, and also Some more diseases include bad breath, halitosis, which we'll be talking more about.
Okay. And you know, with this show, we normally leave no stone unturned, and I'm glad that we have students as well from the Mount Kenya Dental Students Association. And let's begin with some of the conditions that are related to, you know, oral health. What are some of the conditions that exist? Let's begin with you, Ali.
Thank you, Sheila. One of the conditions is bad breath. And bad breath is normally brought about by bacteria, buildup of bacteria on the tongue and on the throat. And for this, there are factors that normally contribute to this. The factors that contribute to this are like poor oral hygiene, dry mouth. There are some health conditions like chronic sinuses or diabetes. For the people who have diabetes, normally their mouths are dry. And now this can lead to things like bad breath, them losing their teeth, so on and so forth. How you can avoid or deal with bad breath is, one, you first of all, you make sure you floss your teeth before brushing. Then you brush your teeth at least twice a day. Then the crucial one, which most people don't do, is you need to scrape your tongue. So easily just buy a tongue scraper, scrape your tongue. And for the people who have health issues like diabetes, they need to ensure that their mouths are not dry. Hydrate as much as you can, because if you have, they normally have less saliva in their mouth. If it's dry, now it leads to bacteria building up, and that is how you end up having bad breath.
Is there an age where someone gets bad breath, or do they get it from when they're born?
No, it goes all around. Any age can have bad breath. Even with the kids that are normally breastfed, you need to ensure that after giving them milk, you take care of their mouth, mostly at night. Yes.
All right.
Thank you.
And I've noticed that you have braces, and sometimes people with braces are seen to have bad breath. So then how do you ensure that you do not get bad breath when you have braces?
Thank you. So mostly when you have braces, the areas that you can't get to are the areas between your teeth, because they are blocked by the wire. So what you do, you need to have interdental brushes. You also, as everyone, you need to have your tongue scraper. Just scrape your mouth. Brush at least twice a day. For us, we're actually told to brush more times, but yeah.
Okay, so how many times do you brush that?
Nearly twice a day.
Twice?
Yeah.
Okay. Let's have Kefa also to explain to us some of the conditions. You could just pass the microphone.
I go by the name Kefa. I am from Mount Kenya University, a second year student, and I'll be talking about periodontal diseases. The periodontium consists of 4 layers. That is the gum, the cementum, the periodontal ligament, and the alveolar bone. So when the gum, these 4 parts, when they're affected, they're infected, they tend to have this disease. And this disease is from progression of gingivitis. So there are various ways that you can prevent this disease. That is by having a good oral hygiene first. And as Elia said, you should also scrub your tongue. And also, when you have ingested sticky foods, it's required for you, when you don't have a brush around, you gargle some water so that the sticky food can be carried away. And also, when gingivitis, gingivitis is formed by a plaque forming on the teeth, which affects the gum. So when you're brushing, you concentrate on the lower parts of the teeth, that's around the gum area. There are various ways that this disease presents itself. So it presents itself as bleeding of the gum, and also teeth being loose, and also halitosis, that is bad breath. And so when you present this sign, I will advise you to go to the dental clinic, yes, that the dentist. You do regular dental checkups, and also there are treatments like antibiotics which will be prescribed by the dentist. So basically that's all about this disease. Yeah.
You've mentioned that could be caused by taking sticky foods.
Yeah.
What are some of these sticky foods that?
Mostly carbohydrates, like chapati. So bacteria in your mouth, everyone has bacteria. So bacteria acts on the carbohydrates, which produce acids. So these acids act on your teeth, demineralizing their teeth. So they cause cavity. So this cavity progress to gingivitis, and then gingivitis to the disease.
Okay,
Yeah.
that's very enlightening. Thank you, Kefa. Let's have Precious also explain to us one of the conditions that are related to the oral health.
Thank you so much, Sheila. I'll talk about tooth decay. Mostly when patients go to the dental clinic, you'll hear the dentist saying they have dental caries or cavities. That is generally tooth decay. This is when a patient has black patches on the tooth surface. Yeah, mostly when you have black patches on the tooth surface, it means that the enamel, that is the outer surface of the tooth, has been eroded, let me say that, because of the demineralization of that enamel.
Yes.
Yeah, so the acids, as he has just said, the acids will act on that susceptible tooth, and it will cause it to have those black patches. I say dental caries is what brings most people to the dental clinic.
Yes.
Some people will, when it comes to halitosis and many other dental diseases, people won't bother too much, like dental caries.
Yes.
So when you're in that dental setup, you'll anytime you are examining the patients, you'll find they have dental caries, the tooth decay. So there are a lot of things that cause this tooth decay. Okay, I'll say it's a multifactorial disease. It's not only caused by maybe the food debris on the tooth surface. It has a lot of causes that may cause that. Maybe what I'll say, there is something like xerostomia, that is dry mouth. You'll find anytime that you don't have a lot of saliva in your, like saliva, the intended amount of saliva in the mouth, you'll find yourself that you'll develop caries generally.
Yes.
And mostly this is because when saliva is in the mouth, it helps in washing away the debris, the food debris after you've eaten. It will also help in neutralizing the acids in the mouth. But once you don't have that, generally it will have to corrode the enamel, and now you have those black patches. But once you visit the dentist, you'll get the help by feelings and all that. It's good to check up on your dentist every time.
All right, thank you so much, Precious, for that. This are Mount Kenya University Dental Students Association, dental students taking dental course, and here at Mount Kenya University. But first, let's take our first commercial break. When we will be back, we will talk more about how you can prevent some of these dental conditions. Let's take a look at the facts and myths both of the day.
Tooth loss is genetic. Tooth loss is largely preventable. Tooth loss is most commonly caused by cavities, which can be avoided with proper oral hygiene. You only need to visit the dentist if you have a problem. Initial stages of gum disease and cavities often go unnoticed until they progress. Getting routine dental checkups every 6 months is important to avoid discomfort and costly dental treatment in the future. You should avoid the dentist while pregnant. The hormones associated with pregnancy may increase the risk of gum disease. About 50% of women develop early stage of gum disease at some point during their pregnancy. So, it's important for pregnant women to be extra vigilant about their oral health and not to skip their routine dental checkups and cleanings.
Thank you for staying with us. This is Body Garage here on TV47 with I, Sheila Chelangat. And of course, today I am not alone with a live audience here in studio, students from the Mount Kenya University Dental Students Association. Guys, mko salama? Are we going good? Yes. All right. Just before the break, you guys did break down some of the conditions associated with the oral, the whole oral part of it. And you deal with a magazine in your school. You have a magazine for this. What are some of the ways that you, as an organization, advocate for good oral health? Let's probably start with you, Charles.
Okay, we have a couple of ways, because as dental students right now, all we have to do is promote good oral health and advocate for better oral health. This we do through our magazines, which my colleague will talk about. We also do outreach programs and dental camps to the less privileged, where they don't have adequate dental care or they lack. So we go there, hold camps and do procedures at subsidized fee or at a free without charges.
Without charges.
Yeah.
So perhaps what is the latest camp that you had? How many people did you reach? And how was the message received by that community?
Okay, thank you. The last camp we had was held in the school environment, but we were open to even people outside the school. For that camp, we had around 250 patients who were screened and notified of what they needed. Unfortunately, because of insufficient resources, we are not able to attend to all of them, but we did a couple of procedures. We did quite a number of fillings under the supervision of our qualified doctors who are our lecturers. We also did some extraction for those who needed extraction, and also more so we gave them oral health talks for those who needed to improve on certain aspects of their oral health.
Oh, that's really good. Esther, if I could get to you, you do have these outreach programs, sometimes visit children's home. How is it when you're dealing with a child in terms of maneno ya meno?
Thank you so much, Sheila, for the question. Well, you find that children are usually phobic to dental care. So when you're handling them, you need to be very calm and collected, because it becomes a task when they start to act out. Yeah, but for us, when we go for the outreaches, we normally go there mainly to do the screening, find out where the problem is, and maybe advise them on what to do. And you find that when we go out there, we also don't go empty-handed. We usually do our outreaches, mostly we carry them dental materials like maybe the toothpaste, the brushes for them to use. So that is majorly how we handle them out there. And we don't only deal with children, but we also deal with the elderly people, we deal with people of middle age, and the outcome has been very good on our side. And so far I can say we have had like 3 to 4 outreaches which have been a major success to our association.
And are there any challenges that you get during these outreach programs?
I cannot say so much. The only problem are normally in terms of finances, because anytime you are doing an outreach, it has to come with a financial implication. So that has been the major challenge. And another challenge is getting the sad reality that so many people are not well bestowed with dental knowledge. And for those people that have the knowledge, they only know it, but when it comes to apply, it's the problem. Because you'll find someone has almost 5 to 6 cavities, and then you ask them, do you normally brush your teeth? And they'll confidently tell you yes. So you realize they know, but now applying it is a problem. So I think that's a bigger challenge. Better strategies needs to be put in place where awareness will be made and people will now take action to implement it, because that's when we can now say is successful.
And with these outreach programs, have you realized what is the most common oral disease that you've encountered?
One of the major problems I've seen enroll is the periodontitis. And majorly it's with the people who are from around the ages of 40 and above. So you find that when you do not have proper dental care, or you do not follow the proper oral hygiene routine, you find that the accumulatives of the bacteria and whatnot will cause maybe, let's say, plaque. And when the plaque is there, and you still do not brush and you still do not do what is necessary, you find that it extends and accelerates to periodontitis. So you find that by the time you are around the ages of 20, you are just doing the normal brushing, that is one day, once a day, and maybe you brush like for around a minute or so, because we don't take our time. And by the time you're reaching like around 40, you find that your gums are starting to recede. And that is when you ask yourself, I've been brushing all along, what am I not doing right, you know? And you find that these are some of the cases that we encounter with the people in that age group. So they'll be like, I've been doing this right, what is not wrong, what is not right, you know? And again, you find that we normally do advisory. So maybe when you're brushing, take at least 2 minutes. Do not do the 1 minute. And we normally advocate that when you're brushing, at least do it twice a day. And also be very keen on your dental checkups. We prefer you go for a dental checkup after every 6 months. And you find that people whose oral hygiene are not up to optimum, we normally advise them to go for maybe, let's say, more time so that they can be screened more and the problems can be figured out on time. Yes.
Maybe perhaps before I get to our friends on the in the audience, Charles, is there what is the right way to brush? Because some would say up, down. What is the right way to brush?
Okay, first we'll start with the not right way to brush. And the not right way to brush is by holding your toothbrush and brushing like this.
Sideways.
Sideways. As you brush like this, you are causing injury to the gum and it can cause gum recession, still leading to periodontitis. So we say we avoid brushing that way. The best way to brush is brushing in round circular motions, but at the back you can find it's a bit difficult to brush because there is no insufficient space there to brush in circular motions. So we recommend you brush up and down using a soft bristled toothbrush, and do not be aggressive, because you find some people are very aggressive. You can hear them brushing and then spitting. So take your time, brush slowly in round circular motions. Take your time to brush all surfaces of the teeth, because someone will present with cavities and they'll say, I've been brushing my teeth but I still have cavities. But if you ask them how do you brush, they'll just tell you I brush like this and then I'm done. If you don't brush all the parts of the teeth, you still get cavities, because the reason we emphasize on brushing, apart from removing the plaque and the food debris, is because fluoride in toothpaste plays a good role, a very big role in remineralization of teeth. When our mouths have acids, or we've taken something sugary, or the bacteria in our mouth, some of them produce acids which degrade the enamel, which is the top layer of the teeth. After that layer is degraded every day, now we have to brush with fluoride, and the fluoride in toothpaste plays the role of getting back those minerals. So we have to work on it.
Quite interesting. You've said no aggressive brushing. You know, some of us make sure that, you know, you're moving so that, you know, you feel like you've actually brushed your teeth. Perhaps if I could get back to the our friends in the audience, are there bad habits that we normally do that lead to bad oral hygiene?
Some of those habits are biting your nails, grinding your teeth, mostly when you are asleep, and also sucking on your tongue. So I think it's a common myth where somebody will think that biting the nails or maybe sucking your thumb, you'll stop when you grow up. Most of the parents think it's because maybe the kid didn't have enough time when breastfeeding, but that's not the thing. Most of the time for these habits, we have factors that contribute to it, maybe anxiety, stress, and when we spot these habits, we have to make sure that we can stop them as soon as we spot them, and not to wait for the kid to grow up and trying to assume that they'll stop.
Yes, Kadzo. Sometimes after, you know, you're done eating, we normally use a toothpick, and you'd find that somebody, even kama hajakula, bado anatumia toothpick. Is that a bad habit? What's the effect of that to your mouth?
I'd say it's using the toothpick. It's not a bad habit, but we really try and advise you to floss your teeth. Most of the times, you'll find that most cases that people have to use the toothpicks for their teeth, it's either because they have cavities, so they're like openings on your teeth, and it's so irritating when you feel that you have something just staying there. So cavities are the main reasons as to why people will want to like use the toothpicks, because if also when your teeth are like not well aligned and you have the spaces, it acts like some site where you can trap the food when eating.
All right, thank you very much, Kadzo. Let me get back to you, Esther. Does diet play a role in maintaining good oral hygiene?
Yeah, thank you so much, Sheila. Diet is very key in your dental health. You find that there are the good things that will promote your oral hygiene, and there are also the bad stuff that are going to deteriorate your oral hygiene. So maybe let's begin with the good stuff. You find that you're advised to maybe chew on things like carrots, do things like roasted maize, maybe just to strengthen and also to give your teeth some bit of strength. And also you're advised to do things like sugarcane, because sugarcane is tough, though it's juicy. It's tough, and it also has some fibers that are going to, do some cleaning on your teeth. And by the time you're done, you'll feel like you're just from brushing your teeth normally. And on the other side of the page, you also have things like sweets. We have a lot of cakes and we have biscuits. These are stuff that we normally fancy, but on the other hand, they're not so good for our oral hygiene. So we are not advising that you do not take these stuff. The only thing we're advocating for is after you've taken the sweet stuff, kindly do yourself justice and brush your teeth. Yeah.
And there's someone who loves chewing on gum every time. Does that have an effect to my oral health later on?
Well, chewing on gum is advisable.
It is?
Yes.
Why?
Because when you're chewing on gum, the gum is going to, maybe you do like maybe a mint gum and such stuff. You're going to chew and it's going to clean. It will act like as if it's cleaning your teeth. Yeah, so that is why we mostly advocate for gum. And it also strengthens your teeth. But on the other hand, if you do a lot of sugary gums, yeah, so that is where the line is drawn. When you do a lot of sugary gums, it will act to deteriorate and not to promote. Yeah.
All right. Thank you for that. Masfin, if I can indulge you, you have been to many outreach programs, and perhaps I'm wondering then, are there misconceptions that you've had about oral health during these programs, and what are they?
Thank you so much. So in our endeavors trying to be advocate and promoters of good oral health, one of the misconceptions that I think stands out up to date, and this is among children and all the people that I can say are the major cause of or the propellers of the problem, the parents, where you find a parent has the belief that if their child loses their permanent teeth, that it will grow again, because we know we normally have two sets of teeth. We have the primary and the permanent. So the kids, when they lose their primary, then there is that chance of the permanent growing. But you realize because of the poor, we can say even diet plan that many parents have made their children adapt to, the sugary stuffs, you realize by the time they are 7 years of age, their permanent teeth have started to erupt, but they already have very severe dental caries. So they step in with their child, and then you tell them that these are permanent teeth, but it has caries. And when we extract these teeth at the moment, it will really interfere with their teeth alignment.
Yes.
So the best recommended procedure is to do a filling if it has not reached the point where the pulp is infected, or if it has reached that stage, root canal treatment is advised. But for them, they'll be like, no, they had one before it was extracted and another one erupted. We believe another one will erupt. So it normally becomes a challenge trying to explain to them and getting them coming into terms with that.
Yes, with that.
Yeah.
All right. Thank you so much, Masfin, for that. Of course, we are hanging out with students from the Mount Kenya University Dental Student Association, and we have just dealt with some of the causes, some of the conditions, and we are up for a second break, but do not go too far. When we'll be back, we'll talk about some of the treatment options, as well as, how can we prevent some of these conditions. Do not go too far. Thank you very much for staying with TV47. This is Body Garage, and we are hanging out with students from the Mount Kenya University Dental Students Association, just tackling and trying to turn, all these stones on matters oral health. And just before the break, we did touch on some of the misconceptions, and you have even talked about some of the treatment options that are there for a person who would probably be suffering from, one or two these conditions. And let me just indulge Bill Ouma. What are some of the treatment options that are available for someone who has a condition?
One of the treatment options that we can have for the dental conditions is the root canal treatment. Now, as Masfin has mentioned before, this treatment is done to a patient or an individual with pulp infection, whereby the pulp is infected and the patient is suffering from the death of pulp. Now, the injury to the pulp leading to the death of the pulp. This pulp is where the nerve, the blood vessels, and the connective tissues are, making the tooth a living structure. Now, the root canal treatment involves the removal of those dead tissues and the dead nerves, the dead blood vessels, allowing the patient to have a dead tooth in the mouth, but it's not extracted. After the removal of the nerves, the tooth is sealed. So the tooth structure is there. It's not compromised. The tooth is not compromised. It's not removed, but it is dead. Another treatment option is when a patient is having a mild cavity. They can opt for filling, and also at a younger age, for the kids, when they're having cavities, they can do the pulp capping to prevent extraction of the tooth, unless the pulp is infected, leading to too much pain. So it will lead to the extraction of the tooth.
Before I go back to the audience, Charles, are there ways to prevent some of these diseases? What should I do?
Okay, everyone needs to prevent themselves from dental diseases. From the moment a child is born and they erupt their first teeth, it's the time we should start taking care of our teeth. So we can start from the children since the moment the teeth have erupted. So you'll find that around 6 to 8 months, we'll have the first primary teeth coming in the mouth. And after breastfeeding, we normally recommend you breastfeed a child when they are not sleeping, because if you breastfeed them when they are sleeping, you find that we don't have the cleansing activity of the saliva, and we will be at risk of getting cavities. So after breastfeeding, you should get a damp, clean piece of cloth and wipe the teeth. We recommend brushing for children below the age of 2 years. From the age of 1 year to 2 years, they should brush with a grain-sized toothpaste on the toothbrush and brush 2 times a day. Another thing is when we've started having the first molars erupting in the mouth at the around age of 6 to 7, there are some molars, if you see the tooth, it is not a flat table. It has some grooves and fissures. So some are very deep and making it difficult for cleaning. So for the very deep fissures, we recommend to do fissure sealants. All that is preventable to prevent us from getting dental caries. Another thing is flossing. We need to floss, because if we don't floss, we'll always get the gum diseases. Flossing, we recommend you can floss after eating things that get stuck into between your teeth. And avoid using toothpicks because toothpicks will injure the gums. So floss, and after flossing, if you're flossing in the morning, floss and then brush. Another thing to prevent the oral health or oral diseases is we have some other diseases we've not talked about, and they are quite common. The oral cancers. We can only prevent the cancers by screening. The screening, the previous month was the cancer screening, and I don't know how many of us got screened, but we should all get screened for these conditions. And for the last part, I'll talk about I've talked about brushing.
Yes, you've talked about brushing, flossing, and screening. Yes.
I'll also talk about the dental visits. It's recommended for everyone to go for the dental visit because when you go to the dentist, it's easy to see something that is at its first stage, and they can inform you. It's not every time we have pain, we have problems. Sometimes we don't have pain, but we have problems. So go to the dentist for the checkups.
Okay, thank you very much, Charles. You know, Charles anauliza, did any one of us go for screening? How many of you did? How many? None? I think we should pull up our socks there. Sometimes there is, you know, teeth loss. And so, Rosemary, is it? I hope I've got the name right. What are the effects of now teeth loss?
My name is Naomi Chepkosgei.
Naomi.
I'm a fourth year student, and most people take the dental visit as an extraction visit, and extraction is not always the only option. And once you've lost your teeth, you have several effects, like the remaining teeth will tend to shift to close that gap. Another effect is aesthetics, especially when you've lost your front teeth. It lowers your confidence. You can't smile normally. Yeah, there are other effects like pronunciations, but we also have an option of replacing that too. Yes, thank you.
All right, thank you very much for that. I would like to indulge Alan. What are some of the steps that I can take to make sure that my teeth are healthy?
Now, the main thing that you can do to ensure that your teeth are healthy are, one, they have always mentioned about brushing your teeth in the right and the best number of times, which is 2, in the right way, no violence, and using the right equipment. And 2, the other main way you can use to check that your teeth are okay is regular visits to your dentist. You know, there is the notion of ukienda kwa daktari unangolewa meno, as someone has just said, but just go check that your teeth are fine, because when you go to the dentist, they'll advise you appropriately and they will give you the right thing that you're supposed to use.
Okay, there's so much insights from you students, and I'm learning a lot from you as well, and it's actually great to hear that you guys are very passionate about oral health. But it would be not good if I end this without getting to hear from our patron. Perhaps you could talk about this whole dental unit. What is it that you do? What is it about this project in the magazine? And then I'm seeing a trophy on the table. When did you get it, and what was it all about?
My name is Joseph Chelimo. These are my students. That's what we do in Mount Kenya University. They have an association by the name Mkudesa, and I am guiding them as their patron. Well, it is part of the university to ensure that we use our products to impact the community. And one way is to use our students, and to mobilize them is via an association. So recently we had in the department, in the faculty, showcasing what are able to do in terms of representing the institution, the community service. So this group here, Mkudesa, were able to overcome all the others. And that's this is the evidence you can see here. They were crowned as an association which are geared towards assisting the members of the community. So we are actually going the right direction. That is our motto. That is our purpose, to ensure that our members feel the products of our institution. And after here, they should be able to access, to give the service to the nation. A healthy nation is, is gotten as a result of a good working force. A sick nation is achieved, unhealthy person, the route to an healthy person is through the mouth. So if the mouth is healthy, then they can be able to eat whatever they want, whatever they wish. And therefore, we build the nation together. That's why we are happy to be part of this group, to come here and to educate, to ensure that, our viewers, our countrymen know all about what is in this oral health. It's a simple and a short, a brief area. And it's a very major part. I'm very happy you introduced this with the World Health Organization records. It's one of the non-communicable disease which affects the entire world, quite in millions. So we are good, we are happy. This one is taking a good shape so that we can eliminate such things. Thank you, Sheila.
Perhaps before you end, what should we expect from you in terms of outreach programs? What do you have in store? What does the future look like for you guys?
Yes, thank you again. Every year we celebrate World Health Day during the month of March. And we did that last March. We went right to the community. And that is nationally. But as an organization, we always do a periodic, either thrice a year or four times a year. We plan for outreaches, we plan for medical camps and dental camps, whichever one we as our plans. When we get resources, we do it as much as we can. Even that, we also send our students to the hospitals. We send them to the schools, we send them to the hospitals during their holidays time or during the attachment period. And we give insight on what we expect them to do. And we are getting feedbacks very well.
All right.
Yes.
Thank you very much, Daktari, and as well the Mount Kenya University Dental Student Association. It has been lovely having you here. I hope you guys have enjoyed your time here. Sure. All right. Thank you for the insights, and as well to Charles, Esther, and Masfin. Thank you very much for your insights on oral health, and continue the good work that you are doing. That's it for us on this episode. Do make sure that you catch us up next week on Thursday on the next episode of Body Garage. I am Sheila Chelangat, and do have yourselves a lovely evening.